All right, let's dive headfirst into this one, shall we? We're talking increased intracranial pressure, or ICP for short, pressure inside the skull, and trust me, you don't want to mess with this.
No, you really don't. We're talking about a closed system in there. The brain, blood, cerebrospinal fluid, all sharing that limited space. And if anything starts taking up more room than it should, the pressure builds.
Yeah, think of it like a water balloon, right? You keep adding water, eventually that balloon's going to burst.
Perfect analogy. That's basically what happens with increased ICP. That pressure builds, and it can damage brain tissue if we don't relieve it.
And it's not always some dramatic injury that causes it. I had this patient once tripped over a rug at home. Seemed minor at first, but it turned out she had a slow bleed in her brain. Led to increased ICP. Scary stuff.
It really emphasizes how even seemingly small things can turn serious. And that's why knowing the signs, those early ones especially, is so important.
Right, because catching those early signs can make a world of difference. So what are we looking for?
Think subtle changes. Maybe someone's a bit more irritable than usual, restless, or maybe they just seem sleepier.
Interesting. The nursing guide I was looking at calls those moderate signs, along with a constant headache that just won't quit. Oh, and sudden vomiting, but without any nausea beforehand.
Exactly. Those are like your body's warning lights saying, hey, something's not right up there.
Like those dashboard lights telling you to pull over and check the engine.
Exactly. You ignore them and you risk running into those scarier late signs, the kind that make you think, uh-oh, this is serious.
Yeah, now we're talking breathing that's all over the place, a stiff neck you can barely move, and then there's the eyes.
The eyes.
Fixed and dilated pupils. That's straight out of a medical drama, right?
It is serious. Our pupils are supposed to react to light, but with increased pressure in the skull, those nerves controlling the pupils get compressed.
Ah, so they get stuck, those pupils.
Yeah, often unevenly, too. Can be a sign that the pressure is impacting the brainstem, which, controls all those vital functions.
And speaking of spooky things happening with the eyes and brainstem, what about the Babinski reflex I read about?
The Babinski reflex.
Apparently, if you stroke an adult's foot and their toes fan out instead of curling, that's bad news.
Yeah, that's not a good sign in adults. It usually means there's pressure on the brainstem. Could be a sign of something called brain herniation.
Brain herniation, that sounds
Intense. It is. It's when the pressure inside the skull gets so high that brain tissue starts to get pushed down. Not good at all.
Okay, so we've got these subtle early signs, then these seriously scary late signs, and then there's Cushing's triad, right? That sounds like a whole other level of bad news.
Cushing's triad is definitely a major red flag. It's this classic trio of vital sign changes that tell us the pressure's reaching a critical level. High blood pressure, a slowed heart rate, and then those irregular breathing patterns.
The study guide I was using called it the C-rushing triad.
Yeah, because it basically means the brain is getting crushed, right? It's the body trying to compensate to maintain blood flow to the brain, but it's a dangerous sign.
So if there's even a suspicion of increased ICP, what happens next?
A CT scan is usually the first step. Quick, clear picture of what's going on inside the skull.
But no lumbar puncture, right?
Yeah.
I read that you absolutely don't do a spinal tap if there's a suspicion of increased ICP.
Yeah, it seems counterintuitive, but think about it. A lumbar puncture takes fluid from the spinal column. If there's already high pressure in the skull, removing fluid can make things worse. It's like poking a hole in that water balloon we were talking about.
Makes sense. Okay, so we've got the signs, we've got the imaging. What about the Glasgow Coma Scale?
The GCS.
Yeah. Is that how they figure out how bad the ICP is?
It's not specifically for ICP, but it's a way to quickly assess someone's level of consciousness.
So it gives you a snapshot of how the brain's doing at that moment.
Yeah, exactly. It looks at eye-opening, verbal response, and motor response. A perfect score is a 15.
So a 15 is a good brain day.
A very good brain day. A 3, though, means someone's in a deep coma.
Okay, so we've covered a lot of ground here. Causes, signs, those diagnostic tests. But what about treatment? What can nurses do when someone's showing signs of increased ICP?
Well, time is of the essence. Every minute counts.
So nurses are really on the front lines here, watching for those subtle changes and acting fast.
Absolutely. And they've got a lot of tools at their disposal. One key thing is to remember, low CO2, low ICP.
Low CO2, low ICP. Catchy. But how does that work?
Well, high CO2 levels in the blood make the blood vessels in the brain dilate. That increases blood flow to the brain, which can actually worsen the pressure.
Ah, I see. So it's like adding more water to that already overfilled water balloon.
You got it. So one of the most important things nurses do is hyperventilation, which helps lower those CO2 levels.
Hyperventilation, so like making the patient breathe really fast and deep.
Exactly. That helps them exhale more carbon dioxide than they're taking in.
So it's like manually deflating that water balloon a bit?
That's a great way to think about it. And in addition to hyperventilation, there's positioning. We want to keep that head elevated in a neutral position, no twisting or turning.
Semi-Fowler's position, right?
Yes, head of the bed raised 30 to 35 degrees, sometimes even higher. Gravity helps drain fluid away from the brain, and keeping the head neutral keeps those blood vessels in the neck from getting compressed.
All about optimizing that flow.
And then there's suctioning. Sometimes we need to clear secretions from the airway, but suctioning can actually increase ICP.
Wait, really? How does that happen?
When you suction, you create negative pressure in the airway that can increase pressure in the chest and, you guessed it, the head.
Oh, so like a chain reaction.
Exactly. So we limit suctioning to 10 seconds or less and always give the patient 100% oxygen before and after.
Makes sense. So positioning, suctioning, what else?
Preventing the Valsalva maneuver is a big one.
Valsalva maneuver, remind me what that is again.
It's basically straining or holding your breath, coughing, sneezing, even trying to have a bowel movement.
Oh yeah, like when you're lifting something heavy.
Right. And that can cause a spike in blood pressure and intracranial pressure, which we definitely don't want.
So nurses are watching for anything that could trigger that, trying to prevent it.
Absolutely. They're also constantly monitoring vital signs, looking for those subtle changes that could signal trouble.
Like Cushing's triad, right?
Exactly. They're checking pupils, movement, how the patient responds to things.
So they're the eyes and ears, the first line of defense against increased ICP. Constantly assessing and communicating with the rest of the team.
You got it. And their quick thinking and actions can truly make a difference.
Okay, so we've covered the signs, the diagnosis, those crucial nursing actions. But what about the medical treatments? How do doctors actually lower the pressure and protect the brain?
Well, there's a whole arsenal of medications they can use, each with a specific target.
So a multi-pronged attack on the problem.
Exactly. One of the most common is mannitol, a special type of diuretic.
A diuretic, so it makes you pee a lot.
Yeah, but mannitol actually pulls fluid out of the brain tissue itself, helps reduce that swelling and lower the pressure.
Like a superpowered diuretic specially designed for the brain.
Pretty much. And then there are steroids, like dexamethasone, to fight inflammation.
Steroids, like what athletes sometimes use. But here, they're using them to reduce inflammation in the brain.
You got it. And we also have anti-seizure meds, like phenytoin, to prevent seizures.
Seizures, I can see how those could be triggered by all that pressure.
Definitely. And in severe cases, they might even use barbiturates, like phenobarbital.
Barbiturates, those are strong, right?
They are. They actually decrease brain activity, which can help lower ICP.
So almost like hitting the pause button on the brain, giving it a chance to recover.
You could say that.
Well, we've covered a lot here.
Mm-hmm.
It's clear that understanding increased ICP is essential for anyone working in healthcare.
It really is. It can be a life or death situation, so recognizing those early warning signs and responding quickly is crucial.
Well, we've explored the causes, the signs, the diagnosis, those life-saving nursing actions, and even the treatments doctors use. But we're not quite done yet, are we?
Not quite. We still need to talk about the long-term implications of increased ICP, what that recovery process might look like. But I think we need to pause here for a moment, let everyone process all this information.
Agreed. It's been a lot to absorb, and it's heavy stuff. We'll be back soon to wrap things up and delve into those long-term implications and the road to recovery. Stay with us. Welcome back to our deep dive on increased intracranial pressure. Last time, we left off talking about all the amazing things nurses can do when someone's showing those signs of increased ICP, those quick actions that can really make a difference.
Absolutely. Those nursing interventions are vital, especially in those critical moments. And we were also talking about the medications doctors use, trying to get that pressure down, those steroids and diuretics.
Right, and those powerful barbiturates in those really serious situations is like they're pulling out all the stops to protect the brain. But surviving that initial crisis, that's just the beginning, isn't it?
It is, and it's important to understand that increased ICP isn't a one-and-done kind of thing. The effects can linger, and recovery can be a long road.
So it's not like you just treat the pressure and everything goes back to normal.
Not exactly. Think of it like a tree that's been struck by lightning. The tree might survive that initial strike, but the damage can have lasting effects.
Oh, I see.
It might be weakened, more susceptible to disease. It might never grow back quite the same way.
That's a good analogy. So increased ICP is kind of like that lightning strike for the brain.
Yeah,
It leaves behind this path of damage that takes time and effort to repair.
exactly. And just like with that tree, the extent of the damage, the path to recovery, it's different for everyone.
Right, so there's no easy answer when it comes to recovery.
Unfortunately not. Someone who had a mild concussion, they might recover pretty quickly, but someone who had a severe bleed in the brain, that recovery process is going to be much longer, much more challenging.
And even if the actual injury heals, there can still be other effects, right?
Definitely. Increased ICP can leave behind all sorts of challenges, physical challenges, cognitive challenges, even emotional ones.
Okay, so let's break that down a bit. What kinds of physical problems might someone experience after having increased ICP?
Well, you can see a whole range of things: weakness, problems with coordination, trouble with balance, difficulty walking. Some people even experience vision problems or seizures.
So basically anything controlled by the brain could be affected.
Exactly. And it's not just the physical stuff we have to think about. Increased ICP can also affect how someone thinks, their memory, their ability to process information.
So like remembering things, following conversations, focusing on tasks, all those everyday things could be harder.
Exactly. Some people have trouble finding the right words, making decisions, or solving problems. It can be very frustrating.
And I can imagine that takes a toll emotionally too.
Absolutely. Dealing with all of that, the physical limitations, the cognitive stuff, it can lead to frustration, anxiety, even depression.
And then you have to consider the emotional impact of the event that caused the ICP in the first place, like if it was a car accident or something like that.
Right. It can be a lot to cope with. It's like this ripple effect impacting so many aspects of a person's life.
So it's not just the physical brain that's affected, it's the whole person, really.
That's a great way to put it. And that's why recovery needs to be holistic, addressing all of those aspects.
Okay, so what does that kind of holistic recovery look like?
Well, it's different for everyone. It's tailored to the individual's needs and goals. It might include physical therapy to help regain strength and coordination.
And occupational therapy to help them relearn those everyday skills.
Right. And speech therapy can be incredibly helpful for people who are having trouble communicating or swallowing.
So it's a team effort, really.
It is, and it's important to remember that recovery isn't always a straight line. There will be good days and bad days, steps forward and setbacks.
But even when the damage is more severe, when that road to recovery seems really long, there's still hope, right?
There is. The brain is incredibly adaptable, capable of amazing healing. We see patients make remarkable progress every day. They defy expectations and regain their independence.
Those stories are really inspiring.
They are. It's a reminder to never underestimate the power of the human spirit and the brain's capacity for healing.
This conversation has been quite a journey, exploring the depths of increased ICP and the challenges of recovery. But we've also seen the resilience of the human brain, the dedication of the healthcare professionals who help their patients heal.
And we can't forget those vital nursing actions that can truly make the difference between life and death.
Absolutely. Well, we've covered a lot of ground, but we're not quite done yet. There's one more crucial piece of the puzzle we need to talk about: prevention.
I agree. Prevention is so important when it comes to protecting our brains and minimizing the risks.
So let's shift our focus to prevention in the next part of our deep dive. We'll explore the practical things we can all do to protect our brains and keep them healthy.
Stay tuned.
Welcome back to the deep dive. We've been exploring all the ins and outs of increased intracranial pressure, a condition that can really, well, put the squeeze on the brain.
It can. And we've seen how crucial those early signs are and how the right nursing actions and medical treatments can be absolute lifesavers.
And we explored that long road to recovery, the challenges, the setbacks, but also those amazing stories of resilience.
The brain is an incredible organ. It's capable of some pretty amazing healing and adaptation.
It is. But before we wrap up, I want to shift gears a bit. I was going through the nursing study guide, and it really hit me how important prevention is when it comes to ICP.
You're absolutely right. We often focus so much on treatment, but prevention is key when it comes to protecting our brains.
Like they say, an ounce of prevention is worth a pound of cure.
Exactly. And with brain health, that saying is especially true.
So what are some things we can do to protect our brains and lower the risk of increased ICP?
Well, one of the most obvious but often overlooked things is wearing helmets.
Helmets, yeah. Simple but effective.
They can make a world of difference. Helmets can significantly reduce the risk of head injuries from falls, collisions, any kind of impact.
And not just for kids, right?
No, adults need them too. Whether you're biking, skateboarding, skiing, riding a horse, anything where there's a chance of falling and hitting your head.
It's like a seatbelt for your brain.
Exactly. And speaking of seatbelts, always buckle up no matter how short the trip.
Another one of those simple things that can save your life, or at least your brain.
Seatbelts are designed to protect you in a crash, and they can dramatically reduce the risk of head injuries. And for little ones, those age-appropriate car seats are essential.
It's all about creating those layers of protection.
Exactly. And we can also do things to prevent some of the other causes of increased ICP, like infections.
Oh, right. Vaccinations.
Exactly. Staying up to date on those recommended vaccines can protect against diseases like meningitis and encephalitis, which can cause inflammation and swelling in the brain.
So make sure you're talking to your doctor about vaccines.
And don't forget about managing chronic health conditions like high blood pressure and diabetes.
Oh, right, because those can increase the risk of stroke, which can lead to increased ICP.
Exactly. It's all connected, really. Taking care of your overall health is a key part of protecting your brain.
So preventing increased ICP isn't just about wearing a helmet or buckling up. It's about making healthy choices and managing those chronic conditions.
It's a holistic approach to brain health, recognizing that every aspect of our well-being plays a role.
Well, this deep dive has really given me a new appreciation for the brain. Its complexity, its vulnerability, but also its incredible resilience.
Me too. It's a reminder that we have so much to learn and that every day brings new opportunities to make a difference in the lives of our patients.
To our listeners, keep learning, keep exploring, and keep those brains healthy.
And remember, knowledge is power, and prevention is the best medicine.
And on that note, we'll wrap up this episode of The Deep Dive. Until next time, stay curious and keep those brain waves flowing.